Good morning. Good morning to those who have joined us for today's OUCAN Statewide Day of Training. Thank you for joining us. Please come on in, grab your tea, your coffee, your treats, because we're getting ready for a really awesome conversation about what's going on in Ohio. We just need to talk about it. And so we have three amazing speakers that have joined us. So it's 9:59. We're going to give folks a couple more minutes to join us. So please, again, go grab your snacks, go get your coffee, all that good fuel, whatever you need to make yourself comfortable to prepare for this awesome conversation. All right, good morning, everyone. It is 10 o'clock, and we welcome you to the first installment of Ohio Urban Community Action Network, also known as OUCAN Statewide Day of Training. Thank you for joining us this morning for the conversation. What's going on in Ohio? We just got to talk about it, you guys. We just have to have a very real and raw discussion about how are we protecting our families, how are we serving our residents, and how are we making sure that our children and young people are growing up in an area in our region where they can thrive and grow together. So thank you again for joining us for the first installment of the Statewide Day of Training. Our next one will be held in September, and we will provide that information for you at a later time. If you already don't know about this brown girl, my name is Yvonne Cherell. I am the CEO and the first CEO of the Ohio Urban Community Action Network. We are comprised of 9 urban community action agencies across the state. Our mission is to empower Ohio's urban community action agencies through education, networking, and advocate for policies that alleviate poverty and promote self-sufficiency in Ohio. What I am very pleased about within the network is that we are the leading source in breaking the cycle of poverty in urban Ohio, ensuring residents are treated with dignity and have the resources to prosper in their everyday lives. Just a fun fact for you, OUCAN and its member agencies serve 56% of low-income Ohioans here in Ohio. I'm sorry, we serve 56% of low-income Ohioans. 56%, that's a little bit more than half of Ohio's population, comprised of the 9 urban community action agencies. Our agencies provide more than 700 services to those households. 42 of them are workforce development programs. We graduate 3,500 young people out of Head Start to kindergarten readiness programs each year. We are the best kept secret right here in Ohio, with a historic background leading all the way back to President Lyndon B. Johnson's administration, in which the community action agencies were written into the executive order. We continue to do that work. So in many of your communities, you will notice our agencies providing these historical institutional services within the community. Just last year, our board of directors voted on the new advocacy agenda, which is one of the reasons why we're here today. We want to talk a little bit about what is advocacy, how can we become more engaged? And after you hear from our 3 really talented, very brilliant advocate gurus in the state of Ohio, you will learn a little bit more about what we need to do. So part of our advocacy agenda includes a 3-pronged approach. 1, affordable housing. We support, of course, programs and policies that prioritize safe and affordable, lead-free housing and reduce the gap in home ownership for underserved buyers. Here in Franklin County alone, the average mortgage in Franklin County alone is $2,500. The average house in Franklin County is $250,000. Even for a 2-person income, that is a very high note for many families and unreachable for a lot of residents. And so we continue to partner with other organizations within our community to promote and support policies that allow Ohioans to not spend more than 30% of their income on housing. Our second approach is workforce career development. We support programs and policies to reduce racial disparities in wages and occupational clustering, programs that promote pipeline to career fields, and companies who invest in people, including entrepreneur social enterprise ventures. We all know that studies show, not only just in Forbes, but right here in Columbus, Ohio, or Ohio as a whole, that Black women, minority-owned businesses, veteran-owned businesses are the fastest growing businesses in the state and leading across the nation and globally. We must continue to think about how are we making sure that our workforce is prepared. We're also experiencing a mass staff shortage. It's not just prevalent in the private sector, but in the nonprofit sector, you will see those numbers suffering as well. And then lastly, our last approach is early childhood education and childcare. We support programs and policies designed to address access, quality, and equitable funding for early childhood education and childcare. Listen, we brought in a very fantastic speaker who's going to talk to you a little bit more about those numbers, but it's astounding what parents are being asked to spend on childcare, similar to that of a college degree or a graduate program. So we need to talk about this. What's going on in Ohio? So let's look at some of these numbers. Let's look at some of these statistics and some of the issues. Infant care costs on average is $9,687 a year. Will Petrick, the budget researcher for Policy Matters Ohio, just recently produced a editorial in the Cincinnati Inquirer to show these numbers and what that investment looked like. We all know that early investments in child care education results in 7 to 12 return on that investment, and most likely keep our young people not only in school, but they go on to live a more successful post-high school career, whether it be in the vocational sector or if they go on to college. So $9,687 a year. In the article, Will Petrick compares this number to that of a college degree for 1 year. For 1 year at many of our Ohio institutions. Effective March 17th, we have a new law on the books. We have several new voter registration laws, and Deidre Reese, who is here with us today, is going to talk a little bit about that. New mail-in and voter identification laws effective March 17th. After speaking with some state representatives, we are learning that there are different forms of voter identification that are being accepted and other forms of voter identification that is not. So it behooves us for all of us to get to know what is it that we will need for the ballots coming up in the primaries and in the elections. In the National Council of Nonprofits report in 2021, they completed a survey and asked nonprofit organizations, about 1,000 nonprofit organizations across the country, 50 states, what is it about their vacancy? What is happening within your workforce development? And they reported that 1/4, which is 24% of nonprofit organizations out of 1,000 who responded to the survey, reported severe vacancies within their organization. 24%. And we all feel the suffering because we understand that where there are vacancies, that means an additional load for those who are still in their current positions, as well as those in the C-suite position. That does not take account for the fact that Ohio is ranked 38th in unemployment stats in the United States. We've all been watching the news. Reproductive and gender identification rights ranks Ohio as one of the most restrictive states, behind some of the top 8 most egregious states to strip away and to impose on people's reproductive and gender identification rights. What's going on in Ohio, y'all? What's going on? Just last year, we saw new permitless carry or constitutional carry laws for gun owners, which now means that a gun owner does not have to disclose their license or certification. You can carry, we've always been an open carry state, but now you can carry without producing any of your licensure or your background for carrying your gun. What's going on in Ohio, y'all? One of our favorite advocates in Ohio, Hope Lane Gavin, with the Ohio Association of Food Banks, has been pushing, along with other advocates, for a state-funded SNAP, the Supplemental Nutrition Assistance Program for older adults. You know why? Because as the ARPA money continues to be depleted, as we continue to lose funding in other areas through the state budget process, we're seeing families literally losing from $273 a month for their benefits down to $23. Please follow Hope on Twitter, and Sharon will put in a link about the new the collection of stories. We want to begin to try to collect as many stories as we can to talk a little bit about how SNAP benefits are impacting our families. And then lastly, this is another area that Ohio continues to struggle in supporting Black women and women of color in their maternal health care. And we know that Black women in Ohio are 2 times more likely to die from pregnancy-related causes. And infant mortality rates continue to remain similar to that of third world countries here in Ohio. So we need to look at this information and we need to ask ourselves, what's going on in Ohio? Today, I'm so happy that we are joined by three amazing women. Listen, let me tell you all, I have some great, great friends. People actually like me. I have some great friends. There are some people you could just pick up the phone and you could say, what's going on? I don't understand. I need help. Can you provide more information? Because this is not my area of expertise. And those people will answer your call. Well, I picked up the phone and I asked three experts, folks that I know that are killing it in nonprofit and advocacy and supporting families, and they all said yes. So today we will hear from three amazing women who are going to talk to us a little bit about, again, what's going on Ohio. And as we do that, we want to remind you of a couple of things. As always, OUCAN, we love good social media. Please follow us. Please use some amazing quotes. We have some hashtags here readily available for you, so copy those down. And please, after you hear a couple of good nuggets, if you listen to any of the statistics and new laws, things that kind of stir you a little bit, give us a shout out and put the information out there. The more people know, the better they are, the better informed they are, and the more they'll know what to do. So please join us in being able to do that. Now, it is my pleasure to introduce to you our first speaker, Ms. Lisa Allen. With over 25 years in human resources, Lisa has evolved from personnel management to delivering solutions that help companies harness the full power of one of their most valuable assets, their people. She's dedicated her career to empowering and motivating employees to realize their full potential and bring their best to their job and their lives. She joined Public Consulting Group last fall, and then with this partnership with the Ohio Department of Medicaid to work on overcoming the provider shortage in Ohio, while helping people gain employment in meaningful areas. So across Ohio, there are hundreds of individuals who need certain Medicaid home and community-based services. These programs serve a variety of populations, and they allow Medicaid beneficiaries to receive these services in their own homes or in their own communities where in-home service providers serve these individuals with care, allowing them to lead independent lives and prevent them from having to go to a nursing facility or other isolated settings. We're going to ask Lisa to join us to talk to us a little bit more about the Medicaid home and community-based services. And thank you again for joining us.
Good morning. Thank you very much for having me this morning and allowing me just the opportunity to present. As Cherell said, my name is Lisa Allen. I'm with Public Consulting Group, and we have partnered with the Ohio Department of Medicaid to overcome the provider shortage of in-home service providers. You may be aware of it, you may not. But it is staggering the amount of individuals that need help. And we just don't have enough providers to help them. As Cherell mentioned, I've spent my career in human resources. My father was a minister and a missionary. My mother worked for our local community action agency, and I grew up watching them help so many people and touch so many lives. Their work and dedication just made such an impact on me. And I mean, we didn't even realize we were living in poverty growing up because we were so busy helping everybody. So when this opportunity came up with PCG to give back, I couldn't resist. So that's why I'm here today. I have a presentation that I'm just going to share with you a little bit about what we're doing today. And then at the end of that, we will take some questions and see if I can help anybody. So I'll go ahead and share my screen here. Bear with me a second. There we go. All right. Is everybody able to see that okay? Awesome. So this morning, I'm just going to talk about the current provider shortage of in-home service workers in Ohio. I want to share this with you to make you aware of this need. I believe that everybody here has a stake in this effort. I hope you find this information useful and can pass it on to your audience, clients, as they consider maybe possibly a career in home health care. This is our Ohio team that we have. There's a total of 9 of us. We cover the entire state. We've kind of divided it up into regions by team members. And then most of us deal with independent providers. Mr. Rainery is our expert on agencies. So he works very hard with people wanting to open an agency or agencies that need help, whether finding employees, growing, doing paperwork, whatever they may need. So today we'll just talk about kind of the challenge and the mission, what are Medicaid home and community-based services, our needs, what resources and support we have, and how we're taking actions. And then we'll open up there at the end for any questions. And feel free if you have something during the presentation to put them in the chat. And if not, at the end of the presentation, I can answer hopefully any questions that you have. So as far as the challenge, first, I guess we should define in-home service providers. They're aides, they're nurses, and home care attendants. And we'll speak a little bit about them in more detail in a few minutes. But home and community-based services, or HCBS, are funded by Medicaid. And they provide services to individuals so they can remain living in their homes safely. The challenge that we have is the growing gap between the number of individuals who need these services and then the number of providers that are available to meet that need. Why is there a gap? Well, one, COVID played a huge factor in that. Two, we have a large movement of people who are leaving institutional settings who want to receive care in their homes instead. And then the aging population is growing. They're living longer. So our goal is to find passionate people who are willing to perform these services and help them in becoming providers, connect them with people who are in need. I have a list coming to me from ODM here sometime in the next week or two with over 10,000 individuals in the state of Ohio who have been waiting to get matched up with a provider, and we have such a shortage. So that's what we're working on. So how are we addressing the challenge? So we've surveyed individuals, providers, and case managers to basically identify needs, and then we've conducted focus groups and tried to develop solutions. And then we're recruiting providers through monthly informational sessions similar to this, but a little more in depth and more geared towards the type of work they would be doing and questions that they have. We do presentations in person or virtual. So we've streamlined the enrollment process, reached out to individuals that are already enrolled to expand their services. Maybe they're providing services under the Ohio Department of Aging or DODD. We're helping them cross over to also providing ODM services. Developing support systems for providers, training, free education, documentation, business toolkits. We offer free consulting services to agencies. We have a mentorship program, and we pair seasoned providers with new enrollees to help them through that path. And then we've also developed PCG Match, kind of similar to like a dating website, if you will, where basically people fill out a profile, somebody who needs services on maybe what they need and what type of hours, do they prefer a male or a female? And then a provider can go in and create a profile, and maybe list I'm a home care attendant or I'm an LPN and I only want to work, within a 10-mile radius of, downtown Columbus, and this is what I'm available. And then they can search and find each other. So we're able to connect them much easier now. As far as Medicaid, most people know it is a government funded insurance. And it's somewhat true, but really there's so much more to it than that. Medicaid provides funding for the services that individuals need to ensure care in their home or when needed care in nursing facilities through both state and federal monies. And there's a wide variety of Medicaid programs that fund an individual's care. And it's based on age, income level, what are their needs, among a lot of other factors. The services that we'll be discussing today are funded by Medicaid, either through one of the waiver programs or through the state plan. Home and community-based services, or HCBS, basically allow individuals to remain in their home by meeting that individual's specific needs. And without these services, it may be challenging for some individuals to live independently in their homes. The relationship between Medicaid and providers. So providers are paid with Medicaid funds through a reimbursement process. However, providers are not Medicaid employees or contractors. So if a person becomes an independent provider, then they'll submit hours worked either directly to Medicaid or through one of the managed care entities, like Aetna, Humana, United Healthcare. Now, if a person goes to work for an agency, then they submit their hours basically to that agency, and then the agency pays that employee, and then they submit to Medicaid for payment. But basically, in all of those cases, the money comes from Medicaid. As far as the needs, we'll talk about the types of providers and agencies that we're looking for, the reimbursement rates and benefits for people to enroll as an in-home service provider. Basically, there are two paths that someone can join. So they can work as an independent provider, and they're considered self-employed business owners or a sole proprietor. Some of them work just simply individually on their own, and others decide to grow into agencies. Now, agency employees, they're actually employed by an existing home health agency that is already contracted with Medicaid. Independent providers, they have an opportunity to run and own their own business, which makes them responsible, obviously, for all of their documentation, billing, and paying taxes. These are areas that we really find that they need help in. So we have an enrollment team that assists them with that. And then they also have control over their schedule, and they have autonomy over their training, professional development, and then they can choose which individuals to work with to ensure a good fit between themselves and the individual that needs services. Now, agency employees, they receive all their training from the actual agency. They get the set schedule, and then they have their billing and pay all managed by the actual agency. But both independent and agency providers, they can work with individuals on either the Ohio Home Care Waiver or the My Care Ohio Waiver. So a person who works as an in-home service provider, they can work as an aide, basically assisting with personal care needs, other activities, maybe light housekeeping, some transportation, maybe help getting dressed. They can work as a home care attendant, which is a little more advanced, almost semi-nursing. They can help with self-administration of medications and assist with the performance of some nursing tasks. And then, of course, we have the nurses, LPNs and RNs, who provide more in-depth services within that nurse's scope of practice. These are the rates that are specific to independent providers. Now, agency employees' wages, those are set at the discretion of that agency. Managed care organizations and managed care organizations are insurance carriers who provide coverage for Medicaid recipients, and they have separate enrollment requirements for providers. But basically, so an entry-level position as a personal care aide, the way that Medicaid has it set up is so that if they come in their first hour of the day at a particular client, and they would be paid at $20.42 that first hour. And then it goes by quarter hour from there, or basically $12.96 per hour for each additional hour worked. If they go to a new client, then that rate starts all over again. And the same with the home care attendant and the nurses, which are at higher rates. Again, the first hour is at that higher rate, additional hours are listed there. And then if they have multiple clients throughout the day, they basically start that all over again. Benefits as far as a career in-home as an in-home care provider. It's very easy entry. An aide, which is a PCA, does not have to be an STNA or a certified healthcare worker. They can become an in-home service provider in as quickly as 30 days. That is obviously dependent upon how quick they can get their paperwork together, work with our enrollment team, get their background paperwork in. Flexibility, the need for providers is basically 365 days a year, 7 days a week, any hour through the day and night. So it's nonstop. Job security, it's the fastest growing occupation in the United States. Employment of personal and home care aides is projected to experience over a 30% annual growth from 2020 to 2030. Many in-home career providers have used this career opportunity as their first stepping stone in their career path. We have so many that have begun working as an aide and work their way. Maybe they go to school, obtain their license, business license, advanced healthcare degrees, and then making a difference. Compassion is such an important virtue for healthcare professionals. In-home service care workers foster a positive relationship with individuals that they support. And for some individuals, that service worker that comes to help them, it may be the only socialization that they have. And their work makes such a positive impact on individuals' days, their life, and that job is very rewarding. Resources and support. So if you're familiar with the process of contracting with ODM, ODA, ODD, it's not a quick and it's not an easy process. And that's been part of the issue of finding providers. Some of them got started, they drop along the way. If they fill out a form incorrectly, it gets kicked back. They have to start over. So basically, we recognize how complex it is. And PCG is holding their hand now every step of the way as they navigate through this whole provider pathway. We do deliver value-added information. We act as a referral source for statewide resources, including scholarship information, grants, and educational programs to ensure the pipeline of future providers. We recently partnered with Youngstown State University. They were so excited about this and have such a need there in that county. They developed a 4-year program where providers who are working maybe as a personal care aide can attend school while they're working to work on an advanced degree. They sourced funding and grants so that there is no cost to those providers. We've also been partnering with Job and Family Services, Ohio Means Jobs and Workforce Development Boards for outreach to help individuals find employment and meaningful careers, enabling them to become independent, no longer reliant on assistance. We've developed processes for referring eligible individuals for WIOA, CCMEP, and TAMP funding for their schooling, transportation needs, and fees. And we've been developing partnerships with high schools, career centers, and coinciding with the health science career pathways. So we've been really busy. PCG will work with any potential providers that you may have in your networks that you're able to refer, and will link them to any valuable community resources, support, and information. And our goal is really just to support them so they can achieve success. And we're going to link them to ongoing and up-to-date information. Some of the resources we've developed for providers, again, include who can provide financial assistance. You know, we've worked with and partnered with a lot of schools, STNA, colleges, universities. We have transportation assistance in some areas, and then again, opportunities for higher education and additional training. So help us make connections is what we ask, that you can take action to help people in your networks and communities who may have a desire for a career in the health healthcare field. We would love to collaborate with you guys who I feel are the experts in your areas to help guide people who may be struggling to find a meaningful employment, or maybe they're interested in a career in the healthcare field. Again, ranging from entry level up to and including owning their own business or obtaining a degree in a higher education. And there are a lot of people who become an independent provider and they want to open an agency. So we have worked very hard. We have a complete program to assist them with that. We've partnered with a small business association. So we have a lot of resources for that. And then we know you have connections with people in your community who maybe they're already providing these services for a friend or a family member. They're not getting paid for it. You can send them to us and we can help them see if we can get them enrolled as a paid provider. A lot of people don't even know they can get paid for what they're already doing. And then I've got some flyers. If anybody is interested, that has a QR code individuals can scan. It'll take them to an interest form. And from there, then we can reach out to them and help them. We have future provider informational sessions every month. They're virtual, the third Thursday at noon. It's like I said, it's similar to this. You can feel free to invite anybody that you think may benefit. And then you can send them to PCG by giving a call to the 877-908-1746 number, or send them to our website. And we do know the demand for providers is ever increasing. We're happy to set up presentations at your individual locations, or if you have groups of people, reach out to me and I will be happy, to do whatever we can to set it up. I just added my email address to the chat, so don't hesitate to reach out to me. And so basically that's just an overview of what we're doing in a little bit of time. I know I went a little fast. If you have questions, please don't hesitate, to reach out to me. With that, does anybody have any questions that I can answer?
Yes, Lisa. So we have a question from Sorrel Howard from Youngstown. She's asking, as a former JFS employee, she's asking if JFS is completing online profiles for the clients as part of the actual waiver approval. Most of the clients in receipt of services are aged or disabled. How would they navigate the system if they don't actually have an advocate?
If they don't, okay, so are we looking at people who are already on one of the waivers, or people that need assistance or need to know how to become a participant of one of those two waivers?
Well, I'm assuming I was really talking about the online tool because you stated that it could match people to aid people that are already like waiting. You said I wrote down 10,000 people like that are actually waiting to be serviced. So that's a large number.
Yes.
And so I'm thinking, I worked at JFS for 17 years, did not work in a nursing home unit. However, I sat right next to them. So like, I know how long the process can take. And if the online tool is something to utilize, if we don't have an advocate that knows how to navigate it for an aged or disabled person, then how would that work?
Absolutely. So they can actually go. I'm going to put the PCG Match website here in the chat. They can actually go to the PCG Match website if they're an individual looking for a provider and get themselves set up in this website. It's very simple to fill out a profile. Once they're in there, have their profile set up, they can start searching. Maybe they need a PCA, maybe they need, an LPN for whatever their need is. And again, like I said, they can kind of cater that to, some prefer, one gender over another, or maybe they need somebody with experience with a Hoyer lift or whatever it may be. So yes, they would go to the website and get that profile set up, and then they can start searching right away. Did that answer your question?
Not really. So no, truly. Okay, so when we're saying that is the individual themselves that need the services. My thing is, if we're doing a waiver and we're approving it at the state level, wouldn't it be beneficial for the person that has all the information regarding what's going on with the client to actually build the general profile so that then are already out there to be matched. Like, I know it's an
The
adding
case
an extra
managers.
layer of work for the worker, but we're servicing the people, right? So
Exactly. Now, and are you referring to like the case managers?
yes.
Yes, the
Yes.
case managers also go in there and they have access to that.
Okay.
So the case managers will be doing that. And I know we're short on time here, but if you want to reach out to me, I do have my email address in there, and I will be happy to talk with you one-on-one or to provide more information for anybody that needs it.
Thank you.
You're welcome.
And Lisa, no fret, to our guests, you know how we do it in the OUCAN family. We will make sure that you have all of the information. This is just simply scratching the surface. We want you to engage with Lisa, Lisette, and Deidre. That's the point of talking about what's going on in Ohio. We want to make sure that we're making those connections. So Lisa, thank you again.
Thank you.
You will have the information to her slides, and we will make sure that all of the information for all three of our presenters will be available to you post the event. Thank you so much, Lisa.
Thank you. Thank you so much.
Now moving on, is my honor to introduce this next young lady. She is a outstanding emerging leader here in Columbus, Ohio. Miss Lisette Arnold was born and raised in the South Linden community of Columbus. In her role as the Community Engagement Associate at Groundwork Ohio, she supports the implementation and execution of the organization's Center for Family Voice that works to elevate the voices of families with young children and early childhood policy and advocacy to achieve programmatic policy and practice changes at local and regional and state levels. Lisette is a person who brings her passion and her values to the work, always focusing on ensuring that the voices and needs of those that are most directly impacted by an issue are at the center of the solution. And again, if you've been around the family for a little while, you may have seen Lisette in the last few OUCAN events, the Leader Link Summit back in October. She provided some information on how we can advocate for our families and some of the tips that we need to practice and procedures we need to practice to make sure that our families are fully engaged. And she was very prominent during the Women's Leadership Symposium 2 weeks ago, where she dropped a couple of nuggets that if you didn't get them, I don't know what to tell you, but it's our honor again to have Ms. Lisette joining us. Lisette?
Hello, everyone. Good morning. So Yvonne just did an amazing introduction, so I won't go into who I am again. I'm going to go ahead and share this, share my slideshow so we can get the so we can get started here. Okay. Okay. So again, hello everyone, and thank you, Yvonne, for thinking of me to bring light to this particular policy area. Today, I'm going to be talking about affordable childcare for families, but before we get into it, I'm just going to go through the agenda and we can get a little introduction of what Groundwork is and what we do here. So today, we're just going to talk about intro to Groundwork, then we're going to go into why we need affordable childcare here in Ohio. We need it everywhere, but specifically Ohio. We'll talk about Governor DeWine's budget proposals, and then we'll talk about Groundwork's additional budget requests. And then we'll talk about, I work for Center for Family Voice, so we're going to talk about engaging families, and then we'll have a Q&A here. So Groundwork is a committed nonpartisan public policy research and advocacy organization formed in 2004 that champions high quality early learning and healthy development strategies from the prenatal period to age 5 to lay a strong foundation for Ohio kids, families, and communities. We have 3 centers of excellence at Groundwork: the Center for Maternal and Young Child Health, the Center for Early Learning, and the Center for Family Voice, where I hail from. So what does Groundwork do? So at Groundwork, we advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. So, affordable childcare. So, at Groundwork, we have found that the lack of accessible and affordable childcare for families is currently costing the state billions of dollars each year. Accessible and affordable childcare would ensure that children are healthy and ready to learn. It will enable more women and families to be fully employed with less disruptions, address the growing workforce needs of existing, new, and anticipated employers across Ohio, and support the growth and development of the state's economy. So Governor DeWine's proposed budget includes investments in childcare capacity. So he's looking at an investment of $150 million of state ARPA funds to provide childcare scholarships and to increase infant and toddler childcare capacity among communities throughout the state. Eligibility and expansion of the state's publicly funded childcare program from 142% of the federal poverty level to 160%. This will result in more than 15,000 children and families gaining access to care. Preschool, an additional $46 million per year in early childhood education grants, estimated to expand preschool to an additional 11,000 children under 200% federal poverty level. And a new department. The governor announced a new Department of Children and Youth to promote efficient and effective delivery of services to Ohio's more than 2.5 million children and their families. And while we appreciate the governor's proposed investments, there was a lot in there about young children. We would still like to see more. So Groundworks Groundwork's additional budget requests include targeted infant and toddler childcare capacity building in childcare deserts. So a new investment of $30 million in state funds to increase capacity of local communities, specifically Appalachian and communities with high infant mortality rates, including the urban communities, to provide safe and developmentally appropriate childcare for infants and toddlers. And for preschool, we asked for $23 million per year in addition to the governor's proposed expansion in early childhood education grants. These additional funds can support providing additional half-day preschool slots or the piloting of full-day preschool spots. So at Groundwork, we believe that parents and families are the experts of their own experiences and know what their babies and toddlers need to thrive. Too often, families aren't included in the policymaking process. That deeply affects their lives and the lives of their young children. So Groundwork is committed to changing this because every family deserves to be respected, valued, and heard. We have been engaging with a cohort of 65 families from across the state for about a year now because we just launched in May of last year. So these families, we've been working with them for a year now. They're included in almost everything we do at Groundwork, attending our events to speak with legislators, our advocacy day, our Vote for Ohio Kids leadership events, and anything we do that's advocating for their children. So here's a picture of me helping one of our families find their legislator's office. We have a close relationships with our families as we strive to implement best practices of family engagement by valuing their time, breaking down barriers to participation, and treating them like the experts they are. Even though we have, we do this for work, we know that these people know what they need. So we're not going to sit on a pedestal and act like we're going to tell them what they need to survive. Okay, so not only do they participate in our events, but they help us to form our policy agenda and budget ask by letting us know what their priorities are and what's affecting Ohio families the most. So the first, I don't know how well you can see the graphics here, but we have one where we made a handout that they could leave with their legislator when they met with them, because we know that when you go talk to a legislator, that much time, or they might have another meeting to get to. So we made handouts that they could give to their legislator with the information, their name, how many kids, and what their problem was concerning childcare. And then in the middle, we have our Family Action Network policy feedback. So when we were planning our policy agenda and our budget ask, we made sure to send the information over to our families to see what they thought of things. Did they prioritize some of the things we were asking for, and just what were their thoughts? And then we make sure that we keep that feedback loop going. We report it back out to the family so they can know what people across Ohio are saying. And then lastly, we collect questions that they have for their legislators. So here we have, why do we continually fight for services that children need to thrive? And then someone asks, what keeps you up at night about your own young children? They ask that to their legislators. So we make sure to elevate questions and concerns like that. And I'll make sure to share these slides with some additional information. If you're interested in the Family Action Network, joining, boosting it, just anything, I'll share that. So if you're wondering how you can get involved in the fight for affordable childcare, I encourage you to try out one or a few of these things, depending on how much time you can commit. So we have, you can provide testimony. So you can do that. You can provide testimony. You can engage with families that you work with at your organization and collect stories. I know even, and this isn't even just with early childhood issues, but I saw in the chat, they said if you have a story about SNAP, you can share that. So just engaging family voices in any issue that you're working with is always appreciated and will help us help Ohio families. So meeting with legislators, open your doors. So if you're working for an organization that needs funding, or not even an organization, or just like a program that needs funding or needs anything, invite your legislator to that space and let them walk around and let them see what's going on firsthand. And then social media, I love social media. I've been sharing this event around everywhere, but anything that that has to do with your issues, I would boost it on social media. Legislators use social media. Everyone, not everyone, but a lot of important people are on the social media sites, and attending local community events. So that's something that I've been doing a lot more, and especially in Ohio. That's how I got engaged with OUCAN, because I want to be involved. I want to know what's going on in Ohio. And the best way that you can do that is by attending these events and reaching out. Okay, so I am the lead contact as far as the Family Action Network. So if you want to get involved in that way, I would contact me. If you want to learn more about our budget advocacy, I share a little bit. There's a lot. There's a lot of fact sheets with specific numbers and issues that you can look at on our website at groundworkohio.com/voices. And again, to join the Family Action Network, you will reach out to me. And thank you all. I am open to any questions. I feel like I finished fast because I was just going.
Well, you went quickly, but you went wonderfully. So that's just
Thank you.
I have a question just to get things rolling. We have a few folks from the network on the call today who work in Head Start or who work in one of our Pathways hubs, which, as you know, work with families dealing with infant mortality issues. How do you convince people to let you tell their story? What strategies do you use to make families feel comfortable sharing their stories? As a recovering reporter and working in communications and community action for a long time, not everybody wants everybody to know their business. So how do you get around that?
Yes, so I think, the way that we recruited, I feel like the way that we recruited our families was a little different. So we actually partnered with community organizations that had very close relationships with families. So, and then they referred us a person that they thought would be open to sharing their story. And it's not always, I mean, we have 65 families, but not all of them has been like super open about all of their, but we do a lot of anonymous surveys, try to protect identities. And then we do a lot of anonymous surveys. And then it really, what I think is to have someone that can connect with people that look like them, that connect with people that look like them. That's a big thing. I feel like I noticed working with the Family Action Network when I came in. I felt like a lot of even like the young moms, they were very interested in sharing with me, but they wouldn't email someone else here at Groundwork, but they would email me. And I feel like that was big. So just being comfortable with sharing your story. It is kind of hard to collect those stories when it's about something that's very touching and could be triggering to them or to their family or anything. Like I personally probably wouldn't share certain things by myself. So it's definitely hard, but the anonymous stuff is big. So the policy feedback, we got all that. That was anonymous. I didn't share their names. I just got they needed, and then we went from there.
Excellent. We do have a couple questions coming in from our participants, not just my head. So what can you do for moms who are looking at a benefits cliff? They can only make so much money before their childcare is taken away. They love to take that promotion, but they need the childcare.
Yes. So I can say that's one of the biggest issues that a lot of our families have within the Family Action Network. And what I can provide some more resources after this, because we're not, obviously we're like policy advocacy, but we don't have, we can only ask for things. So by doing that, we get families who have this benefits cliff issue, and then they go testify at the State House. They go tell legislators to their face, like, hey, I can't take this $2 raise because I'm going to lose my benefits. And it's a problem, not even with childcare, with food benefits, with everything. It's a problem across the board. So I think it's just something that we have to keep amplifying as a problem within our community, because it's across the board, really. So sorry if that didn't answer your question, but I definitely have a lot of resources I can share.
That would be great if you'd share those along with your slides. That'd be fantastic. Do we have time for the one more? We do.
Yeah, no, so I'm sorry, I didn't mean to.
Go ahead. That was Jasmine's question. Go ahead, Jasmine, follow up.
Yeah, because that was my question. So I do have 2 small kids, and it's like a really, really enormous issue that I have. And so what you're saying basically is it's not immediate. So if I do decide to take a raise or anything, like that's the reason why I came to community action, because I'm like, oh, we do have a head start here. My kids can come here, but that's not the case for everyone. But I have so many opportunities here where I can grow within the company, but I can't work unless, I have some stability with my kids. So what options do I have? Just stay complacent until they're 8 and I can, leave them at home or something? Like, what do you say is the option for moms to work?
Exactly. Yeah. I'm sorry you're going through that. It's just, I just wish that there was something immediate that we can do, but we don't. Like in our budget request, we're asking for 200% of the federal poverty level, and it's like until they raise that, there's nothing we can do until they raise the benefit. I mean, the eligibility numbers. So yeah, again, I'm sorry you're going through that. I wish I had more answers for you.
Well, one thing you could do, Jasmine, is let Lizette tell your story.
Yes. And I have no problem. I will tell you everything because I'm a Head Start advocate. I don't have an issue with being transparent, but it's just frustrating because I need options. What am I supposed to do with my kids? I'm not able to work until I have, for the childcare.
So one of the things I will offer to all of our attendees and the support of Lisette and Groundwork does an amazing job of, as Lisette said before, capturing the stories of our families, because if we don't have their voices at the table, and I love what Lisette said before about lifting up families and amplifying their voices. Groundwork does that very well here in Ohio. They have a plethora of information. They have different social media outlets where they effectively use a lot of information. They benchmark their budget asks, they benchmark the policies that they're asking for. So I will highly encourage everyone on this call, if you have other families who may be facing the issues around the benefits cliff, or other issues that maybe it's the food, maybe food services, food resources or things like that, please touch base with Lisette and Groundwork, because they really do have a great handle on how can we take this information back to the governor's office, speaking with our state legislators, testifying, things like that. So make sure you get in touch with Lisette, post this event, join the Center for Family Voice. Lisette, can you tell us a little bit more about that, since I just already opened my big mouth? Can you tell us a little bit more about that? Because it's an excellent opportunity. And I think we just recently received an invitation for OUCAN network to participate.
Yeah, so you guys are, OUCAN will be on our advisory council for the Center for Family Voice. So and then Yvonne, you'll be the point person for that. So our Center for Family Voice is, I explained the Family Action Network. That's one of our biggest initiatives that we have going on within the center, but it's all about bringing family voices to policy. So everything that the Center for Family Voice does is working towards bringing families to the State House, collecting their stories, amplifying their stories, and investing in their leadership, because that's a big part, is investing in their leadership, because a lot of people don't know the power that they have and they don't think that their voice matters. So giving them that platform, and then telling them like, hey, like, we're all experts here. How can I tell you what you need for your 2-year-old? That's one of the biggest principles of the Center for Family Voice. And then I have so many resources I'm going to share, but I have a Center for Family Voice report. We have reports on, we have like webinars on Head Start. There's so much stuff that I can share with you all.
Fantastic. Yes, if you'll send all those, we are recording, and we will be providing the slides and the recording on our website after the event, probably early next week after the holiday as well. We do have another question. How do you deal with perceived quality issues? Childcare is big business today, and people who can afford to pay higher prices wouldn't voluntarily choose Head Start for their child. How do you get around the quality question?
How do you deal with perceived quality issues? So I think the perceived, I'm going to be honest, I actually don't have an answer for that right now. I actually don't, because I obviously, like, my work is centered on the family voices part, but I do have someone to connect you with, our Center for Early Learning director, and she would definitely be able to answer that.
Okay, great. Do you hear in the stories that you're telling, do you hear issues with quality? Is that folks are struggling to find, they might be able to find care that's close to their house and very accessible and affordable, but they just don't trust it? Or do you hear that sort of thing?
Yes, that's a big problem for a lot of our families, as far like education, like even like just the education for the child, but the neighborhood, the facility, like there's just a lot of problems that families have with the childcare centers in their area. And when that's all that's there for you, you have no choice. When you have to go to work and it's 30 minutes away, and then you have to go, you don't have time for childcare drop-offs in the morning. So it's a big problem for a lot of our families.
So I was going to say probably Head Start with the hours that they provide, matching up with what the parents need, has always been kind of a challenge, especially with manufacturing growing, and those are mostly night shifts and things like that. It's a challenge to find the correct childcare for the job.
True.
Yeah, so that's why the family stories are important, because when you have people telling you that, like, okay, you want to bring all these businesses to Ohio and you want us to work, there's different shifts. So there's going to be different needs for different people. And you're going to have to accommodate that, or we're not going to be able to, or our economy is going to be held back.
Right, exactly. Yeah, making sure all of those different voices and different needs are heard is your specialty. So thank you, Lizette.
Thank you all.
I think we are good on questions for Lizette. So we appreciate you being here, and we're going to move on.
That's right. So thank you again, Lisette. I knew you all would just absolutely love her. As I mentioned before, please reach out and ask her a little bit more information about the Family Center, the Family Center initiative, ways you get more engaged. And Lisette is an excellent advocate in this state, and she provides a lot of good tips for how we can advocate for others as well. So please feel free to connect with her after this event. Now we're going to move on to our third presenter, who is just an absolute favorite of mine, a special friend, someone who is just an amazing, passionate, energetic individual. Ms. Deidre Reese has a long history of advocacy and service and has a passion for community empowerment. She has community and public policy experience, including 8 years as a legislative aide in the Ohio House and the Ohio Senate, 10 years as a lobbyist, and then the director of governmental services with the statewide labor organization, as well as executive roles for several nonprofit organizations that empower people. In her more than 30 years of working professionally in the public policy and advocacy arena, Deidre has fostered and maintained relationships with many community groups, as well as leaders and elected officials at the local, state, and national levels. Deidre holds the honor of working for the first African-American woman elected to the Ohio Senate, and at one time was the only registered African-American lobbyist in the state of Ohio. You go, Miss Deidre. She was the youngest and first African-American to serve as director and chief lobbyist for National Education Association and state affiliate. And so now it is absolutely my pleasure to welcome one of my favorite women in the sisterhood, Ms. Deidre Reese, to join us.
Hi, everybody. Thank you so much for that, Yvonne. It is such an honor to be here with you all today, and such an honor to be able to present with both Lisa and Lisette. You ladies absolutely rock. Thank you for all that you do. I'm delighted to be able to share some information with you. Not always the type of information that I have to share, but hopefully by the end of this presentation, you'll be a little bit better informed about what is going on with the voter registration laws in the state of Ohio, and you'll be motivated to go out and encourage other people to get informed so that they will be prepared for the upcoming election. So I'm going to start to share my screen and get into the presentation. Okay, hopefully you can see it now. Just slideshow. I do this to myself every time. Okay, there we go. So just wanted to start out just by giving you a little bit of information about the Unity Coalition itself. We are actually a coalition of multiple organizations. We are a nonprofit 501c3, and we are a part of the National Coalition on Black Civic Participation, which is housed in Washington, D.C. Our major focus and aim is to increase political literacy and civic engagement in minority and underserved communities in Ohio. So mostly Black people, but there are other people certainly that we are concerned about, and we have run programs for the past 20 years, a little bit more than that actually, in Akron, Canton, Cincinnati, Cleveland, Columbus, Dayton, Lima, Toledo, and Youngstown. So pretty much our urban areas. Lima is an emerging area, and there are some other places that are starting to emerge that have reached out to us to want to see us to start to engage in those areas, but those are the places that we have primarily been working. And I just gave a couple of the logos of some of the organizations that have made up a part of our coalition. So Community Mobilization in Youngstown, the Masonic Order, the Black Greek Lettered Organizations, A. Philip Randolph Institute, the Links, NAACP State Conference. So a little bit of everybody, but we also have individuals who are a part of our coalition who have been very committed to engaging underrepresented people across the state of Ohio. computer to work. It's been freezing on me all day. That's not fun. Okay. It is frozen. Well, I guess I'm just going to have to wing it here because my screen is frozen. I'm going to come out and try again. Technology just does not like me for some reason.
No problem. We're super flexible, Sister Reese. If you, as you get a chance, if it unfreezes or something, if you want to send it to Sharon and I, one of us, or send it to me. But
Right,
keep on.
let's see. All right, let's see if this is going to work here.
Use
All righty.
technology, they said. It'll be fun.
All right, I know, right?
Listen,
All right, well, I'm gonna try to email this. What is not my gift or my ministry, as I tell people all the time, is trying to send things while I'm actually in the Zoom, but I'm gonna make that happen. So, but I can start talking while I'm doing this. So House Bill 458 was passed back in December of last year, that started out as a bill that would just basically eliminate the August election, and which primarily school districts would put ballot issues on for, for school levies. And the legislature said, that's happening a little bit too often. It's costing communities too much money to have these special elections. So they started out with this bill. But then what happened? It became this major bill that changed the voter ID laws. So now we have these voter ID laws that have made a significant difference to how we actually have to show up prepared to vote on election day. And all of the provisions are now in effect as of tomorrow. So I'm going to hit send on this presentation. So it should be coming to you, Yvonne, now. So basically, we no longer can show up to vote with like our a utility bill, which we could use to vote before if you didn't actually have an ID, a cell phone bill. Now we actually have to have some other specific things in order to actually show up to vote. So what the concern is that we know we have people who actually don't have those documents in hand. We want to make certain that everybody is aware of what they need, because with this primary coming up in May, there are going to be people who show up thinking that they can just appear the way they have always appeared. I had an experience in the November election where I was doing voter protection. We go around to different polling locations where people have had problems in the past. And there was a woman who was standing outside, still waiting for it. She was standing outside waiting for, crying, literally. And, of course, I asked her, what's the problem? And she said that she did not have her ID because she was robbed the night before. And I was like, oh my God, poor thing. And I said, well, do you have a utility bill in your name? And she said, yes. And I said, go get that utility bill and you can come back. And fortunately for her, she lived close enough that she could walk back home, get her utility bill and come back on site and vote. Well, now with these new rules, that's not an option that she's going to have. So, we want to make certain that everybody understands what their options actually are. So it's very, very important that we get everybody up to speed on what is actually going on. So if you want to go ahead and advance, I think slide 3 or 4. Yeah, there we go. So absentee, in-person voting, we're still going to have that. People are still going to be able to vote. They did not take away any days, though there was some discussion about that. But it is going to impact what you need to do when you show up to vote absentee in person, as well as if you show up to vote on election day in person. But if you vote absentee by mail, you can still use the same ID that you're currently using. Next slide, please. Okay, so what's not changing? Voter registration. You can still do the same thing that you've always done with voter registration. You are not required to submit a copy of your ID. There's some misinformation out that you still have to have a copy of the ID to turn in with your voter registration. That is not true. You can just use your state issued ID or your driver's license number on your voter registration form itself. You do not have to have a copy of any other documentation. Next slide. But if you vote early in person or on election day, you do actually have to have a photo ID. Before 458 passed, if you voted early in person, other than on election day, you could use other documentation. That has now changed. Next slide. So what's allowed going into effect officially tomorrow? An unexpired driver's license, an unexpired state issued ID, or an unexpired passport. The passport is new. That was not something that was allowed before because we had to have something that had an address on it. My personal commentary, this is a classism issue, right? Because a lot of people who don't have sufficient funds to travel out of the country would not have a need for a passport, right? So you're creating this division, yet again, creating a barrier for some people that would not exist for others, because likely if you have a passport, you probably have another ID anyway. So what's no longer allowed is an expired driver's license or a state issued ID. Obviously, if you have an expired passport, that would not be utilized. But what was previously allowed was a utility bill, a government paycheck, a bank statement, or other government documents with a current address. They've taken away that option if you were trying to vote early in person. Next slide. If you vote in person without a photo ID, whether it is at the early vote time or on election day, you have now only 4 days to provide an actual copy of an ID. If you don't do that, even though you are required by law to be allowed to vote a provisional ballot, it will not be counted. So before, if they checked and you were still on the voter registration roll and you had cast a provisional ballot, your ballot would still be counted. Now, if you don't come back with that ID, it is not going to be counted. That's going to be a shocking thing for many people to find out that their ballot may not be counted. You used to have more than 4 days also to provide that ID. So we need to make certain that people understand they got to do a quick turnaround as well. Next slide, please. Okay. The state will issue an ID card at no cost under a couple of conditions. If you're at least 17, if you don't have a driver's license, or if you have a driver's license that is suspended, they can issue you a state issued ID because they want to make certain, and I'm doing that in quotations, that you will be able to vote if you're otherwise eligible. But you have to apply for this at your local county board of motor vehicles. And if you have also, if you're a person that has had a name change, you can also get a free state issued ID without having to pay for it. So if I got married or I got divorced and my name changed, you can get a state issued ID. And you just have to fill out the forms. Now, if you lost your card or you damaged it, the state's not going to provide it for you for free. You would actually have to pay the cost for that. And what happens is the state reimburses the county board of motor vehicles, Bureau of Motor Vehicles, for the state issued ID card. Next slide, please. Okay. It's basically just repeating what I just said. You won't get a card if you already have a driver's license, and they won't pay for it for a duplicate or reprinted card if you already have one. Okay. So of course there's some required documents that you need in order to get a photo ID in the state of Ohio. There are 6 different things that have to be demonstrated in order to get it. Your full legal name, your date of birth, that you have a legal presence in the United States, some document with your social security number, your Ohio street address, and proof of a name change if that's applicable. You could have some document that have multiple of these things. So a birth certificate, for example, would satisfy all of these things with the exception of your address and your social security number, right? obviously, if you had a name change, you got married, that wouldn't be, relevant, but one document could meet several of these different criteria, but 5 of these at minimum would have to be met. Likely, if you're a woman who's been married, you would also have to do proof of a name change. Next slide. So acceptable documents that would meet these first 3 criteria: birth certificate, passport. If you are a naturalized citizen, your citizenship documents, a consular report of birth abroad, a military ID pay stub, which would have your name and your social security number, and then also a certified copy of any court order issued in the state. That could also be an acceptable document. Next slide. For social security number, you have several options: a Medicare card, a W-2 or 1099, your pay stub, as long as it has your name and your social security number, and it's for the current, within the last 12 months of when you're presenting it, your social security card itself, military discharge papers, as long as it has your social security number, the full number, and then our original or certified copy of a school record or transcript that has your full social security number. Then your Ohio street address, a bank statement, auto title, utility bill. Not going to read through all of it, but you see you have multiple options here. And you see some of these things appear on more than one list. So it can be satisfied. Those 6 things can be satisfied by more than one document, or again, one document may satisfy multiple. Next slide. Okay. Again, if you have a name change, you would need to have an original or a certified copy of a marriage certificate or license, or of a divorce decree or dissolution or annulment. This usually obviously impacts women more than men, because we're the ones that tend to change our names. So we need to make certain that we have that, and it sometimes can be a little bit more of a challenge because we don't think we need all of that, but we absolutely do need that in order to get the appropriate ID. Next slide. So what can we be doing right now for all of this? We need to be telling everybody that the rules have changed for in-person voting, that they cannot use those other documents like a utility bill, for example, which was the main thing we kept telling people. Encourage people right now to be working on getting their requirement documents that they need so that they can get the valid photo ID. We can also share information with people on how they can get the free ID, because people may not have the resources to do that, particularly some of the folks that we tend to encounter. Share that people can still vote by mail using the last 4 digits of their social security number or driver's license number. So if it's an issue, they don't have the underlying documents to get the photo ID, or it's expired, I would encourage folks to vote by mail, and we do have the ability to track our ballot so they can make certain ballot was received and that is counted. That's a very easy way to avoid all of these other hoops and rings of fire that are going on. But also reinforce for people, if they do go in person to vote, that they only have 4 days to provide that valid photo ID. And I did not say before, there are some people who may have a reason why they don't do a photo ID. Usually it's a religious exemption. They can sign an affidavit also as to why they are not having a photo, but they need to make certain that nothing pops up somewhere else, because that could be a violation of voting law. So we want to make certain that that's not an issue. But again, the main thing is that they only have 4 days to do that cure on the photo ID. Next slide. There is an organization, it's not new, but it's new to Ohio, called Vote Riders, that is working in coalition with the Unity Coalition, the Ohio State Conference of the NAACP, and the A. Philip Randolph Institute to do training for what we're calling navigator trainings on how to obtain the photo ID. So people will learn, what are the steps that you need to do? How do you access all of the necessary documents? And then Vote Riders actually has financial resources. So if people need to get a birth certificate, for example, they will actually pay for the birth certificates as long as people meet certain criteria. So we are actually helping to co-sponsor this training with Vote Riders and these other organizations, and would love to have you all share it in your networks or have you participate in the training. Next slide. So you literally can scan this QR code and sign up for the training. We will have multiple ones. So what we're trying to do is have a training, I believe it's the 3rd week of April is what we're looking at. But as I said, we will have multiple trainings. And so these will be navigators that will help people to access this. And we're not managing the financial resources at all. Vote Riders is handling that part. And as they explained it to us, let's say this organization had 12 people who were going to be navigators, they would provide you all with a credit card so that you could actually pay for the birth certificates, for example. So, you know, we just want to make sure that we're a resource so that people can get the documents that they need to get the ID so that they would be able to vote. And it's not a 2023 poll tax, basically. Next slide. Okay, so one other thing that I just wanted to make you aware of, you know, this is the Deidre way of talking about something that she thinks is completely ridiculous. So my question, when 40% or statement, when 40% can overrule 60%, Ohio's on a dangerous path. Right now, we have some members of the legislature who are attempting to weaken the strength of the will of the majority of voters by changing the Ohio Constitution. You probably have heard about this. They've been talking about it in even the national media. HJR 1 and SJR 2 are companion legislation that would put language on the ballot to change the Constitution that basically says you would need 60% of the vote in order to change our Constitution. Right now, it's just a simple majority, so 51%. Right, would allow us to change the Constitution. That's how it's been since 1912. But now, in great wisdom, our legislature is saying we need to go to 60%, and they're trying to put this on the ballot in August. Next slide, please. Basically, this would allow a minority to always defeat the simple majority of voters. It just doesn't make sense. So, you know, 41% would be able to defeat 59%, no matter what. That just does not make sense. And again, this is something we've had in place since 1912. It's been working. And even though they have very, very weak arguments as to why they're doing it, this is the path that they're on. It's even more disturbing that they're trying to put it on the ballot in August. If you recall, when I first started talking about the voter ID law, House Bill 458 was originally introduced just to eliminate the August election, largely because those elections have very, very low turnout. But here we are trying to place a constitutional amendment on the ballot in August that would say you need a supermajority of the people in order to pass a constitutional amendment. And we know it's not even easy to get to 51%. So this is basically making it even harder for anything to pass and giving greater weight to a no vote than to a yes vote. Next slide. And just a couple examples of constitutional amendments that passed in Ohio by less than 60%. Our minimum wage at the rate that it is right now. The restrictions on smoking indoors. Having casinos in the state that has brought us lots of jobs, even though I know everybody isn't, you know, necessarily supportive, we did get jobs out of it. The jobs package that we have right now, our drinking age, just a couple of examples, all passed by less than 60%, would not have met this threshold had they been in place. Next slide. And then these are some issues that are being discussed right now that could be impacted. There's discussion about increasing the minimum wage to $15 a minimum wage. Something else regarding healthcare. There, you know, we've had a lot of things that have happened in terms of healthcare and what's covered and what's not covered. So there's been some discussion about that. We know there's lots and lots of discussion about reproductive freedom. There is a ballot initiative that has been qualified and signatures are being gathered right now. There's always been ongoing discussion about medical marijuana, and there are signatures that are being collected around that. Redistricting is back on the table, even though redistricting did pass, the way it was implemented to draw the lines that we are currently under did not quite turn out the way was anticipated. And there have been discussion about clarifying some definitions that seem to be the issue as why it was not handled the way people thought it was going to be handled. If we have this 60% threshold, what's going to happen? So there's concern about what's the real motivation for this. And again, if in August we have approximately 10% of the electorate who actually turns out, you're saying you want a really tiny fraction of the people to make the decision to say 40% of the people can stop 51 or 59% of the people from having the outcome that they want when they go to the ballot. Just doesn't make a whole lot of sense, at least to me. Next slide. So we have been working in a coalition to try to get a no on HJR1. So there, and you'll get this slide, and it's actually linked. So there's some messaging around it, but the main thing is it's unfair, it's undemocratic, it's unpopular, and it's unnecessary. Let the people decide. Let the majority rule, which is pretty much what we believe in democracy in the state of Ohio. Next slide. So I've got two asks for you today. One is that you would register or encourage others to register for the training, for the navigator training on the voter ID, because this law takes effect tomorrow. And then to contact House Speaker Jason Stevens to tell him to oppose any efforts to place HJR1 or Senate JR2 on the ballot in August, and the bill to repeal House Bill 458 is Senate Bill 93. We don't want to see that pass either. And there's his phone number. You can give him a call and tell him we think it's a bad idea. Up until last week, he was opposed. Now he's starting to waver. If he holds his opposition, they probably would not be able to get this on the ballot for August, because you need a supermajority in order to put it on the ballot. So we need to put the pressure on him. So please encourage anyone to call him and say this is a bad idea. Okay. Next slide, I think it's just my information. Yeah, there we go. So if you want to learn more about the Unity Coalition, you can go to our webpage there, and then there's my email address and my phone number. I'd be happy to talk to anyone, and we're always looking for more partners. We do a lot of work with folks. We actually, when we have funding, we certainly have a lot of people who volunteer, but when we have funding, we actually hire people to do door-to-door canvassing, to do phone banking. We do go in and we advocate at the legislature, at the county and the city level around a number of issues. We provide support and training to help develop local as well as statewide plans and campaigns around various issues. We've been very successful in some, not as successful in others, but the great thing is that we're helping people gain skills around advocacy and just empowerment in general. And we've actually had some people who have come out of our network and run for office and are serving at various levels. So, you know, that is hitting the mark more than anything, because, you know, we very much believe that education and engagement is empowerment. And that's really what we want to do. So thank you.
Terrific. Thank you, Deidre. We do have a couple questions coming in from the chat. First off, the difficulty in obtaining an ID. Sade has asked that we go back to the slide where that shows the criteria for getting a free ID. But one of the questions I had while listening to you was, do we have a sense of how many people don't have a valid ID and the reasons what's stopping them from having a valid ID?
The estimates are there are about 200,000 people who don't have an ID. Wow. Some of it is age related because a lot of people don't drive anymore. So they've felt no need, and because we have, you know, a lot of things are technological. I don't need anymore. I just, I've done things online, so I don't have to show up with anything. And since I'm not driving, so that's one issue for a lot of folks. And then there are just some people, I just don't have one, or maybe they don't have the ability to access the underlying documents. And I use my own family. Both of my parents are now deceased, but neither of them were born in a hospital. And my dad was born in Georgia. And I always tease, and I used to laugh at my mom, rest her soul. The house that she was born in doesn't exist anymore. And if it did, it would be right smack in the middle of 71, right? But my dad had to have a special affidavit come from Georgia to say he was indeed who he was. But it was the person who delivered him that said, yes, this is him, and he was born at this particular time, because there was no physician there. Right. So, everything is not as simple as some people believe that it is. So if you are that type of person, it's not as easy. And then you have other people. I work between 8 and 5. So for me to get off to go, to get my documents, I may not be able to do it. And I got to leave at 7 on the bus to even get to my job. So, you have all sorts of things, or I have to decide between this $10, $11 to get a birth certificate and feeding my baby or paying childcare. What are you going to do? To vote? So, there are lots of considerations that come into play that people who don't have the same challenges don't count as important, that are very, very important.
Good, very good points. Thank you. The other thing that we notice in our network is a lot of our clients are mobile. They move a lot. Does the address on their ID have to be current when they present it for voting?
It does not on the ID itself. However, they do need to be registered at the address where they live. And this is not on the slides, and this is one of those nuances, right?
Mm-hmm.
Because anyone in the state of Ohio can challenge anybody else's registration. So if I say I'm going to challenge Sharon's registration because I know Sharon doesn't live at 1234 Mockingbird Lane, but when I challenge, I have it sent to Sharon's address that used to be 1234 Mockingbird Lane. By law, you cannot forward any election-related mail. So that mail has gone to your former address, and you have not had an opportunity to see it nor respond to it. So because you did not respond to it and show up to a hearing at the County Board of Election, you could be removed from the voting roll.
Wow.
But let's say you got it. Let's say you did still live at 1234 Mockingbird Lane. If you cannot or did not show up at the County Board of Election, you could still be removed from the voting roll. And that happened to tens of thousands of people. And oh my gosh, the 2008 election and the 2012 election in Ohio, Franklin County alone, there was this one woman in 2012 who challenged 687 voters. And they asked her, where'd you get these names from? Oh, well, somebody gave them to me. Because by law, you are supposed to have your current address, but we're very mobile.
Right.
And we don't update.
Very mobile.
Does not get forwarded. So you don't even know you've been challenged.
Wow. That's incredible. One of the things we learned recently from one of the representatives that the advocacy committee met with was that there is at least an effort to try to allow like hunting and fishing licenses in some of the rural counties. Are those photo IDs? Are they allowed?
They're not photo ID. There are some legislators in Ohio that want to allow that. And there are some states that do allow hunting and fishing license, but they don't allow college IDs, even at, a state college or institution. So it's interesting, isn't it?
It is interesting.
Yeah.
It is interesting.
Yeah. Begs the question of what are you getting at? And I should say, even though we hear this You know, we need these laws to be tightened because there's all of this voter fraud. One, that it's a fallacy that fraud is happening to the extent that it impacts election outcomes. It's just not true. The numbers don't bear it out. And what does happen, it is not impersonation. The only type of fraud that would be prevented by ID would be impersonation. That's not what's happening. What has been happening is I got the mail, I got the ballot at my house, and my spouse passed away, and I went ahead, or parent, and I went ahead and cast their ballot because I had their information and I sent it in for them. So it's not that I pretended to be Yvonne and then I went in, and we don't even live in the same place. You know, so we're not addressing anything that's a real problem, but in no way has it actually impacted the outcome of an election.
Now, you did go into great detail, and appreciate that, on how to get a free state ID. But back to those underlying documents, a certified copy of birth certificate is not cheap.
It is
Has
not.
there been any movement to make those underlying documents available for free?
We have attempted, we have lobbied for that. Frankly, I was surprised that they took in $458 for the ID, because as many times, I mean, I've probably got 7 or 8 General Assemblies has this even come up, right? That I've been personally involved in. So I'm shocked that that happened. But that's why it's a blessing that Vote Riders is coming into the state of Ohio and paying for it. And this is what they have done in other states. So it has made a big difference in terms of being able to provide for that. And what we're hoping and praying is that the state of Ohio won't decide to restrict that, because we have, you know, restrictions such as our organizations could not provide a postage stamp, for example, to return a ballot. That is a violation of law, right? So, you know, right now we're
explain
good.
that further, because I don't understand that.
So if, for example, the Ohio Unity Coalition could not provide postage to Sharon or Catherine or Jerry to return their absentee ballot, because that is considered an inducement to vote.
Oh.
So we are not allowed to do that.
Interesting.
So we have this thing, you know, we should be encouraging eligible voters to vote, correct? And I don't even know what postage is, right? Because I bought a bunch of the forever stamps because I saw where we're going. So I don't know. I haven't had to buy any stamps for a while, but whatever it is,
It's crazy.
It's right. I'm just,
yeah.
I'm throwing that number out. 50 cents is on the level of like a RICO violation because I provided it to somebody. But there have been people who have been, you know, had to sort of face the music.
Wow.
Because the state said, you're inducing people to vote, and we think you're trying to get them to vote a particular way because you gave them a postage stamp. Okay. So our organizations don't do that, even though it would help people. And one of the other things that was put in 458, they restricted whose ballot you could turn in. Like I used to be able to say, oh, okay, we did this at, you know, my club meeting. Yeah, hand me your ballot, I'll go and drop them off. No, I can't even drop off all family members of mine anymore. It's restricted. So do you want more participation or do you want less? I think I know the answer to that, which is why we have to tell people, and I think everything we've been talking about, the issues that are important, that people are dealing with, you know, we want to tell their story. We're constantly talking to them. We're talking with a researcher this afternoon because we want to draw that out, because part of what we do is talk to policymakers, but another part of it is talking to the public and telling them why their voice does matter. And when they engage, they can impact who is sitting in those seats making those decisions, because, you know, we have to go from being outraged by things to demanding and getting the outcomes that we want, right? You know, I know I'm personally tired of turning on TV and going, oh my God, that thing happened again and nobody's doing anything about it. And you can fill in the blank for whatever that thing is, but I want to show people the connection between, you know, the folks that are making the noise and getting what they want, and those of us who might be just going, I can't believe that happened again. There's a way to get there if we actually engage and hold them accountable. And how do we bring all those pieces together?
Well, thank you, Deidre. I know you have some great resources. We'll make sure to include those in the post-event email that we send out next week.
Thank you so much.
And I too want to say thank you to Deidre as well, because that was the perfect transition into this last part of our conversation. But as you can hear, Deidre is very passionate, very energetic. I have always known her to be not only just knowledgeable, but helpful and resourceful for those folks who are looking to be more engaged. So again, we will have all of the post information readily available for you after today's conversation. So Deidre said, what must we do? And it's a must, not what can we do, what should we be doing? It's a must, we have to. So let's talk about advocacy for a little bit. Part of my background, I've served in public policy and legislation for maybe the last 15, almost 20 years. And I've been very pleased with the work that I've been able to do, from juvenile justice and advancing support for young people who were formerly incarcerated or involved in any type of correctional facilities, to working with young people who have been aging out of foster care or emancipated. Always engaged, and to Deidre's point and to Lisette's point, is about using our voices. So let's talk a little bit about advocacy, and I'm absolutely going to lean on my girlfriends here, Lisa, Lisette, and Deidre. If you all have anything to add in this last 20 minutes of this presentation, just a quick advocacy one-on-one, because you have a lot of experiences as well, I will welcome your comments. So let's talk a little bit about advocacy and what we need to do. Advocacy is absolutely just giving our voices on behalf of other people. I've always been an advocate. I was that big mouth individual in class. If I saw other people being picked on, if I saw other students being treated unfairly, I'm absolutely going to speak up. That's advocacy. If my receipt is wrong, I want to speak to the manager. I want to speak to the regional director. I want to speak to whomever can make the change for me. That's advocacy. I am a breast cancer survivor. Susan G. Komen's sister founded the Susan G. Komen Foundation, because at that particular time when her sister was diagnosed with breast cancer, we did not have the depth of research, funding, and awareness that we have today. She was just one person out of Peoria, Illinois. I had never heard of Peoria, Illinois ever in my life until Susan G. Komen's sister founded the foundation. That's advocacy. Anytime you're giving your voice on behalf of others, that's advocacy. Acting in support of a belief or a policy. Lisette, absolutely. Groundwork, absolutely believe in affordable, quality, safe childcare for young people. That's advocacy. Flat out, that's advocacy. The support or of recommendation of a policy. We talked about the benefits cliffs, and what can we do? We can advocate for a policy change. We can create a recommendation to take to our lawmakers that will benefit those families who are most impacted by that $2 increase, that $2 raise, or that bump in their support that no longer qualifies them for other subsidies. What is important about advocacy is because key decision makers react to those credible groups and individuals who are speaking to bring their issues to the forefront. I remember, like Deidre, like Lisette, you go to the State House, you go to various facilities to be able to advocate on behalf of those issues. And the people who seem to be the most responsive are those who have their facts, they have their information, they stand out. The groups have all of the things that they need to be able to share why this is or isn't a good policy. How is it going to impact the people you serve? Sometimes you're going to absolutely have to take the voices of the people that we serve to the State House, because oftentimes, like Deidre said, we don't know what's going on in other folks' lives. We don't know how many jobs people may have to maintain in order to pay their rent. We don't know some of their situations. And so that's why we have been put in this remarkable position to be able to do so. What we also know about advocacy is that the governments have a bunch of other folks competing for their interests as well. I remember AT&T, or I think it was Verizon a couple of years ago, when we were having conversations regarding the Department of Youth Services and advocating for a decrease in charges, phone charges, so that young people can call their parents while they were incarcerated. Well, Verizon had a great interest at that particular time for those charges to remain, because they are for profit and they make money from those charges. But it disconnects, as Deidre said before, when our families don't necessarily have the kind of resources to support that. We're talking about a deeper dive in disconnecting families from their young people. We're talking about a deeper dive in recidivism, because young people don't think that they have someone to care about them. They're receiving a phone call. So the governments have other organizations, other companies who are competing for interest as well. And so that's why our voices need to be just as loud and as prominent as those who are also visiting those offices. The main thing is, if you don't engage, someone else will. Like Deidre said before, if you don't speak up for yourself, someone else will say it for you. We've all seen the saying that, you know, if you don't talk about your pain, they will kill you and say that you liked it. That's not the kind of advocacy environment in which we want to continue to support our families. So it's up to us to be able to bring these issues to the forefront. And then lastly, you have the power to affect change. Bottom line, if we don't like something, we can most certainly make those changes in policies. We can make those recommendations. Remember, the Susan G. Komen Foundation started with one woman. One woman. It is a multi-billion-dollar industry at this point. There are football players who are wearing pink in honor of breast cancer awareness. The Breast Cancer Awareness Foundation has a global span, and it only started with one person. So let's look at advocacy in action. What do we need to do as we prepare our agenda, our talks, and our meetings with legislators? One, you need to define the issue. What is the real issue? Oftentimes we become so consumed with being able to debate the opposition that we forget our real issue. If the real issue is the benefit cliffs, then that's what we want to invest and pour our time and our resources into. We want to make sure that we have all of the facts. We want to talk a little bit about some of the families, the profiles of families who may be impacted by it. We want to maybe consider some sort of ambassador or a champion who can help us advance our issues, someone who may have benefited from policy changes on those particular issues. The second thing we want to do is identify possible solutions. One of the things that we saw Jerry share in the chat is, why don't we all just have a free ID? Why can't we afford, well, we probably could, but why don't we have an ID for everyone, free IDs for everyone? It would absolutely, that's a solution. That's an absolute solution. It absolutely would make it a little easier. Deidre mentioned before, just providing a 50-cent stamp. It's a solution for many people who, again, may not just have that access. So we need to become more solution-based when we're approaching these conversations with policymakers. The last part of that is developing an engagement plan. You heard Lisette mention how Groundwork does a great job of following their families over a course of a year. That's a real comprehensive engagement plan, because part of that shows what has happened with these issues impacting our families pre-policy and what is happening after policy. When we can keep track of those kind of benchmarks and those milestones, this helps us continue to create another development plan or an engagement plan for other areas that we may that may come our way. So here's a couple of different types of advocacy. You can always attend town hall meetings. I think you all heard, and this kind of goes hand in hand with networking a little bit. I think you heard Lisette share earlier that part of her goal is to get out in the community, to learn a little bit more about what's going on, how our other constituents may be dealing with certain issues without having their voices at the table or hearing the dynamics of the different conversations. Then sometimes we may not understand the variances around people not being able to vote or people not being able to accept the $2 raise or whatever the case may be. So attend those town hall meetings, attend campaign functions if you can, attend groundworks information, attend Ohio Unity Coalition, get more engaged with PCG. This is how we can make those kind of changes the more that we understand what's going on in our community. The same with attending rallies. Oftentimes you learn what is at the depth of some of these issues. Sometimes what we get is, again, what's in the news? What did we see on the front page? But there's so much more to the story. There's so much more to the lives of people that we sometimes see in these high profile situations, and going to different rallies or protests gives you a little bit more insight to that. Be prepared to provide public testimony and comments. We see this all the time, all the time. Lisette offered a wonderful toolkit provided by Groundwork in which you can testify if you that you can testify on behalf of your clients and the people that we serve. Deirdre mentioned as well being able to give those public comments. We got the number to Representative Stevens' office. We need to take advantage of being able to lend our voices at those times. It's great to hear from us, but if we can organize our families to help, that goes a long way. You know, hopefully at the State House, some of our legislators may know who Yvonne is, or they may know Deidre, or they may know Lisette because we work in these environments. However, what they don't know sometimes is the other faces, the other families, the children who are being impacted by the new policies and changes in laws. So we need to be prepared to provide credible testimony and comments when changes are being made. Let's make sure that we're voting on all levels, local, state, and national level. Listen, we've heard this so many times before. Don't take a chance and take for granted that the national elections is the most important election. Oftentimes, the things that we're seeing, the infractions in our community, some of the divide in our community is at the helm of folks that we elected, that we didn't maybe pay attention to their career profile, that we didn't know that certain issues were more important to them and there were some things that weren't. So make sure that we are voting on all levels, because the judges are just as important as the President of the United States. Always listen and take notes on who's speaking on various issues. I do this all the time. I like to go back and double check. You never know. We just heard Deidre say that at one point, Representative Stevens seemed a little less likely, and now he's been in a little bit. So now this is a great opportunity that when you educate someone, when you inform them and provide them with a little bit more information, sometimes that information can be key to how they decide on any policy or any law. So make sure you're taking the notes. Listen to what sides some of our representatives or our senators or any lawmakers, learn what are the issues that are important to them and take notes on that so that you can use that in a conversation when you're making your recommendations or a policy ask. The other thing we always encourage constituents to do, email, call, or visit your policymaker. I recognize that, as Deirdre said before, many of us, we work an 8-hour job. We have a lot going on. Post-pandemic, if you can call it post-pandemic, is still a little rough and tough. But so is the things that we're seeing in Ohio. They're making it a little bit more tough for some people to be able to vote, making it a little bit more tough for some people to get that promotion and affordable childcare. And so we need to invest the same energy, that equal energy. We need to match that kind of energy with making those phone calls, emailing them and visiting our policymakers so they always know you. I want any policymaker I visit at the State House or at the Rice Center that as soon as they see my face, they say, uh-oh, here comes that little brown girl, Yvonne. She's getting ready to talk to me about families in urban communities. I want them to know that. I want my face to stick out as that advocate for urban community action agencies. And then lastly, consider becoming a member of a social service organization or a social issue organization. Deirdre and I are both members of sororities that have very large engagement, legislative engagement initiatives and advocacy initiatives. That helps a lot because you can host your own specific advocacy days. You can host your own specific day on the Hill or day of action. So sometimes, the strength is in the numbers. We know that when there are 100 people speaking from the same hymnal, sometimes things get changed, and we've seen it. Although I'm still saying one person can do it, but there's nothing wrong with having a bunch of your friends join you in advocating for the same issues. So meeting with policymakers, here's a couple of things that you should know. And I'm saying policymakers because oftentimes our issues are not necessarily just within the state. There may be some local issues that you may be wrestling with. Perhaps it's something with your local school board, or perhaps the PTA, or any other association in which there are policies that govern the entire body. So how do you make those meetings? How do you make changes with them? So here's a couple of tips that we like to share about that. One is you have to do your research. You absolutely have to do your research. It is absolutely embarrassing to go into any situation and not know. You are the expert. You need to know more about them than they know about you. You need to know if the last time they went to a golf outing. You need to know where are they on this last issue. Any of those little nuggets can help expand the conversation in ways that you never know. Sometimes some of my most successful meetings were built around knowing a little something about that legislator or that policymaker that then fed into the issue that I was there for. So do your research, become a little bit more, and people enjoy that. They always remember what you remembered about them. I'm not even a state legislator or perhaps that important, but I love when people still remember that I am a member of a sorority, or they may remember something, a small nugget about me. It makes me remember them even more. So again, do your research and make sure you get to know a little bit more about those folks that you're going to be meeting with. Be prepared. Bring your handouts, bring your policy agenda, bring your plan of action. You may not need it, but it's better to have it and not need it than to need it and not have it. And when you're creating your one pagers, I always suggest just kind of a one page, and we can check in with Deidre and Lisette on that, but just kind of a one pager would do. So try to hit all your major highlights and just kind of that one page, because after about one page, many policymakers may not sift through all of that information. We love it and we think it's great. And that's good if you want to keep it in your back pocket for another occasion, or if they ask for you to follow up or send them more information. But for the first meeting or first couple of meetings, just having a really illustrative one pager will get the job done. So be prepared for that and bring all your handouts. When you go in, don't take for granted people know who you are. I do that sometimes, but introduce yourself, your organization, the issue, and most importantly, just be personable. Again, some of my most successful meetings with lawmakers when I was just being myself. I put my clothes on, one arm, one leg at a time, just like they do. I hurt just like they do. I have bills to pay just like they do. So they are people just like we're people. The biggest difference though is we are the actual experts. We're the ones in the fields. We're the ones working with our families. So we have the influence and the power. So just be personal, go in and be who you are, share who you are, but most importantly, just be personable. Be very clear and concise about the meeting. Again, there's nothing worse than having all of your information prepared. You have your handouts, you're on time, and then you get sidetracked with a lot of things that doesn't have anything to do with your issue. So try to be as clear and concise about what you're in there for. If you have an ask, say that, and they love that. They love knowing, well, what's your ask? What's your solution to this? What is your recommendation? So be prepared to say, well, I like to see that the federal poverty level be increased to 250% because many families, we've done the research, that 74% of the families that we serve don't even, so be prepared for that, but be very, very clear and concise. And I would also say too, use kind of your hybrid. So a little bit of your facts as well as your compelling stories. Like Lisette said before, we have to talk about our families. We still have to keep the faces at the forefront because these are real people who are not eating every day. There are real people who are not able to pay their rent every day. There are real people who are experiencing gun violence. So we need to keep it at the forefront that we're talking about real people. Percentage is fine, numbers are great, and you most certainly want to use that as a part of your position. But you want to make sure that we're sharing that there are real people who are hurting behind some of these policies, and we can do better together by making their lives a lot stronger. Make sure you be respectful and stick to the issue. I won't bore you, but next time, I got a conversation for y'all the next time. One time I met with a former senator. He's no longer a senator now, and it was around a juvenile justice bill. At the time, it was around gross sexual imposition. And, you know, the charge would be for underage 16-year-olds, 17-year-olds. And we had a bit of a disagreement. It wasn't very good. My son, I think at the time, was 16, and it really went sour. And that was a costly lesson for me, because I did go in there prepared. I had my talking points and everything, and I allowed myself to be baited into a debate that didn't go well. So if you can, at all costs, just be respectful. They always say, I don't know if you've all heard this before, there's no permanent friends, there's no permanent enemies, just permanent interests. That's it. That's what people tend to care about. One day someone could be very much favorable about a bill or an issue that you are passionate about, and on the very next day or a month or two may not have the same level of interest. So always stick to the interest and be respectful. Make sure you just say thank you. I know this seems very simplistic, but it really does go a long way. It's about relationship building, and this is a key point to building those kind of relationships. So make sure you say thank you. If you have any follow-up information, send it, because they're still looking for it. We met with a number of state senators about 3 weeks ago. We shared our interest in maternal health, and we've been receiving the bill numbers, when it's time to testify, all of that information, because we want to strengthen our relationship with that particular center for that issue. The issue is maternal health. We want to continue to support and advance maternal health. That's our issue. So if you say you are going to follow up, make sure you follow up and say thank you and all of those things. I think you heard Deidre and Lisa said before, again, it's very, very important to invite lawmakers to your agencies. They need to see what you do. In my former Head Start days, we used to have the governor. This was a long time ago, y'all. Some of the governors, I don't know if some people, young people might remember, but we used to have them come in the Head Start centers, and they would sit at those little tiny desks, and the young people would, play with them, and they would be in the kitchen area and in the living room area playing with and it's the most enduring thing to see a lawmaker having that kind of engagement with our constituents. And most importantly, is building a relationship is something they get to see for themselves. They get to see how parents check into the center. They get to see how children learn through play. They get to see all those things that we are advancing. So make sure you bring them to your facilities and your organizations. And then lastly, I would say stand out. Stand out. I'm a big, go home type of person. Anytime you can be as dope and big and grand as you can, do it. Have your t-shirts, like I have on my OUCAN polo today. Wear your Deidre sorority. They do a day on the Hill with one of their most, awesome sorors who is in Congress, Congresswoman Joyce Beatty. And they do their day on the Hill. And it is undeniably the most beautiful thing you've seen, because you see all these beautiful women in red. You know who it is. So stand out. Any opportunity you get to, if you get out and bring props. Lisa Hamler-Fugit from the Ohio Association of Food Banks. Lisa is one of the most, I don't know any other word to describe her other than dope. She uses paper plates at times to testify, and holds up paper plates in the committee hearing so that they can see how many families are going hungry every day. Those kinds of props and stand out and creativity, it really brings it home. And lastly, just vote. Make sure you vote. Here, we'll make sure that you get this slide as well. We encourage you to download a couple of different resources. There's so many digital electronic resources that you can use to keep track of different bills, different laws. I encourage you to join a podcast or listen to, some of your favorite podcasts. There's a bunch of information kind of coming your way. So if you can, please download that information. And lastly, I want to say thank you so much to our special guests for bringing it home today. So join me. I know you all may not be on screen, but show some spirit fingers from Miss Lisa Allen, from Miss Lisette Arnold, and Miss Deidre Reese. Thank you so much for spending time with us today to talk about what's going on in Ohio. Remember, this is just our first installation. We will come back and see you in September. Until then, please touch base with Lisa, Lisette, and Deidre. Get more information and look for your post information from today's event. Thank you so much, everyone, and have a wonderful rest of your day.